Welcome to the virtual tour of Riverside Methodist Hospital in Columbus, Ohio. Riverside is a 1,000-bed teaching hospital, housing multiple medical specialties and residency training programs in addition to internal medicine. Riverside is the largest hospital in the Ohio health system, functioning as a main tertiary care center for much of central Ohio and the surrounding states. Care sites located on campus include multiple intensive care units, the Bing Cancer Center, inpatient hospice, multiple outpatient primary care offices, and inpatient psychiatry. You will be introduced to many of the areas of the hospital we frequent as residents throughout the tour.
The Medical Education Department, which we know as Med Ed throughout the program, is where the residents do a lot of their work throughout the day. This is mainly because there is a large computer room for resident documentation where a lot of the residents do their pre-rounding, as well as where a lot of residents hang out after rounds and tidy up their work from the morning, as well as await admissions or consults, depending what service they're on. There are several other offices within the Medical Education Department, including the Clinical Research and Scholarly Activity Faculty Support Offices, the Chief Residence Office, the Administrative Coordinator Office, as well as the Program Director and Director of Medical Education Offices. All of the staff and administration is in one place, and there tends to be an open door policy where you can walk into anyone's office if you have an issue or question and talk with whoever you need to talk to throughout the day. The medical library is an invaluable resource for us as residents when we are embarking on a research project. There are dedicated librarians who are easily accessible and very helpful at gathering articles on a particular topic and parsing the literature. Within the library, there are computer workstations if you want to document on your patients in a quiet place. There are also private study rooms, as well as a conference room for medical student chalk talks and senior board review. The Gibbons is a newly developed area at Riverside that houses a computer room for resident documentation, a large conference room, as well as intermediate-sized and smaller conference rooms. Our main lecture hall is a state-of-the-art conference room where we have our daily didactics. It is here where we have case conference, board review, lectures, and other educational sessions. Our didactics take place from 12:30 to 1:15 p.m. This is protected educational time during which you are excused from service unless there is a pressing need. Several inpatient services utilize the Gibbons Education Center for table rounds. The resident-run inpatient service, known as the Clinical Medicine Service, has table rounds in an intermediate-sized conference room where residents and the attending physician are joined by a pharmacist to round on their patients. There is a large shared screen where we can open patient charts to look at imaging, EKGs, and labs together as we work through our patient list. There are two small conference rooms located across from our lecture hall where the inpatient pulmonary and family medicine team table round. In a similar fashion, a large shared screen is utilized to go over imaging while we talk about our patients. All of these conference rooms have whiteboards so that we can have chalk talks either during or after rounds. The Gibbons Educational Center is meant to be a private center for residents only and has dedicated private resident restrooms.
Our Center for Medical Education and Innovation, commonly referred to as CMEI, is a state-of-the-art facility located on the 4th floor of the McConnell Heart Hospital. It is comprised of 3 distinct areas: the Conference Learning Suite, Laboratory Skills Center, and Virtual Care Unit. Within CMEI, there are multiple boardrooms and conference rooms, perfect for meetings, interviews, and lectures. We have monthly interdisciplinary conferences held here, along with the residents in our family medicine, OBGYN, surgery, and psychiatry programs. During COVID, this has been a perfect location for distance learning, teleconferences, and the recording of lectures for virtual viewing. Our patient examination rooms provide opportunities for direct observable provider-patient interactions. In the past, we have practiced history-taking skills and goals of care discussions with our patient actors. Our skills lab is a great place to practice procedures such as intubation and placement of central and arterial lines. All interns spend time here sharpening their skills prior to their ICU rotation. Our ultrasound curriculum is a great supplement to the real-life experience we gain in the ICU. Residents practice cardiac, pulmonary, abdominal, and vascular ultrasound skills with our chief residents and faculty periodically throughout the academic year. We also encourage our residents to not only practice here in the skills lab, but on the floor during their rotations. Our simulation center or virtual care unit has 4 adult simulators, 1 pediatric simulator, and 1 infant simulator. Throughout our training, we utilize this space for code blue simulations as well as difficult medical decision-making simulations within the ICU.
This is where the ED providers typically sit. You can find attending physicians as well as mid-level providers working here. Usually they're very friendly and receptive to any questions you might have. These are the resident workstations where you will sit when you're on rotation down here, as well as you're putting in admission orders. This is one of several trauma bays in the emergency department. Riverside is a level 2 trauma center. These rooms are also used for cardiac arrests and other critically ill patients. This is a more detailed look inside a typical patient room in the emergency department. This is where you will likely meet your patients for the first time when you're admitting them to the hospital. The bulk of your time spent in these patient rooms will occur when you're on night float admitting patients to the hospital. Interns do at least 2 and up to 6 weeks of floor nights over the course of the year. You'll alternate admissions with your fellow interns.
The McConnell Heart Hospital, home to nationally and internationally renowned experts in heart and vascular care, was built in 2004 to provide state-of-the-art cardiac care to patients and their families. The McConnell Heart Hospital is also home to several outpatient facilities, including our atrial fibrillation, structural heart disease, and advanced heart failure clinics. The 6-story tower houses several diagnostic and interventional facilities, including our cardiac catheterization labs, electrophysiology labs, as well as our cardiac imaging and stress labs. Located on the 3rd floor, our cardiac telemetry unit includes approximately 100 inpatient beds dedicated directly to cardiac care and rehabilitation.
On the 4th floor of the blue building is where the resident staff medical ICU is. There are 2 sides to the unit, the red side and the blue side, which are run by 2 different physician groups. There are a total of 32 beds, with beds 1 through 16 on the red side and beds 17 through 32 on the blue side. Here is an example of a patient room in our medical ICU. Rounds typically start between 8:30 and 9:30 a.m. As an intern, you will cover anywhere from 6 to 8 patients daily on your ICU rotation, depending on our census. You are overseen directly by either an internal medicine second-year resident from our program or by an emergency medicine second year from the Doctor's Hospital program, who we also work with. One of the benefits of working in an ICU without any fellows is that you get to work directly with the attendings who are in the building and available throughout the day. You also, as an intern, get first dibs on many different procedures, including intubations, central lines, arterial lines, and chest tubes, just to name a few. You get to take ownership of your patients and have a good balance between autonomy and supervision on this rotation. Here is a clip of our resident workroom on 4 Blue. The structure of this room has since changed to ensure compliance with social distancing due to COVID-19. This is where you will work on your notes. We also have lectures in here at the beginning of your rotation to review common topics such as shock and ventilator management. We have a waiting room available on the floor that patients' families can use while they wait to see their loved ones. There are also call rooms available on this floor as well, which are typically used on floor nights, as during your ICU night rotation, you will often be too busy to sleep.
Constructed in 2015, Riverside Methodist Hospital's Neuroscience Center is ranked by U.S. News & World Report as one of the 2018-2019 best hospitals for neurology and neurosurgery. The 9-story tower includes 224 private rooms and 409,000 square feet dedicated to our brain and spine patients. The Ohio Health Neuroscience Center represents a unique approach to care by fostering collaboration between neuroscience, heart and vascular, and cancer care. In one location, patients can receive a complete range of neuroscience care, including inpatient and outpatient treatment, neurodiagnostics, interventional procedures, research clinical trials, surgery, and education. The Neuroscience Tower houses several medical and surgical disciplines, including the surgical ICU, cardiovascular ICU, neurocritical care unit, as well as interventional procedural suites, neurodiagnostics and imaging, and our integrated stroke unit. Outpatient facilities include interdisciplinary clinics for MS, stroke prevention, and movement disorders. Finally, the Neuroscience Tower houses several state-of-the-art amenities, including a large, sunlit family waiting area, our chapel and meditation room, as well as a Starbucks coffee shop.
Next, we visit the call rooms. You'll oftentimes use these when you have some downtime on nights to relax and catch some Z's. The intern call room on the ground level has a shared space with TV, comfy couch, and ping pong, as well as some private sleep rooms. Upstairs in the blue area of the hospital, you'll find upper-level call rooms with similar private sleep rooms. Welcome to the cafeteria, where you'll see we have several healthy and hearty options based on what you're in the mood for. Every pay period, you'll get $110 to put towards these purchases. We've got well-known options like Subway and Starbucks year-round. The grill area always has favorites like burgers, tenders, and fries. You've got a salad bar, a few rotating options which are occasionally filled by local restaurants, or days for wings, and prepackaged options when you're in a hurry. The cafeteria is open from 6 a.m. to 2 a.m. every day, and you also have Tim Hortons, which is open 24 hours a day.